Good morning and welcome back to Sunrise. Well, today we're talking about the 7th annual conference of the Jamaica Veterinary Medical Association and the Caribbean College of Family Physicians Jamaica chapter. The theme is going to be One Health, focusing on how humans, animals, and the environment all are interconnected and play an important role in such issues as climate change, plant health, and pandemic readiness. Our guests this morning are co-chair of the CCFP Jamaica, Dr. Aldith Butland, and the co-chair of the JVMA, Dr. Paul Cadogan. Welcome.
Good morning.
To both of
How
you.
are you?
Good morning.
Thank you so much for being here. When I first heard about the wide gamut that you'll be covering, I was like, okay, vet, because I heard vet first, and I'm like, okay, animals. Then I heard humans, and I'm like, wow.
And
this
then
is
climate change and pandemic.
Quite a vast coverage there. Talk to us about, let's start with the lady. Talk to us about why that particular, component and spread across so many different areas.
Well, we have a planning committee, and we thought about what was so important to each one of us and what we want to share with Jamaica. And we thought also what would have been important to Jamaicans, because we're having so many earthquakes, so many storms, one after the other. It has been so hot. Humans and animals and plants were very affected because the plants wilting. And then we hear about mining and excavations, and we wonder, did that mining have something to do with the earthquake over there? So,
flooding.
so it's all connected.
We do live, and I think maybe as a veterinarian, I can see the connection between, family physicians and vets, because people who love their pets see their pets as family, as extensions of their family. Tell us about that nexus and why some of these issues between the nexus of our pets, our pet family members, and our human family members needs to be something that more people need to care about.
Yeah, that's a very, very important area. It goes beyond that too, but the issue of pets and their health, and we humans and our health are interlinked because they're things that can pass between us.
Right.
So that's one of the things I try to emphasize with my clients is keeping their pets healthy.
Right.
Helps to keep them healthy, especially the small kids.
Yeah, babies, yes.
And the thing is that exposure to pets is very important and very beneficial to our health and mental well-being as well. So, that link is important, but it goes beyond that to, food safety, because animal products are part of what we consume. That's nutrition for us. And we have to see that these animals are also healthy. We can, trace their origins. If there are any diseases, we can deal with it. Again, with the objective of keeping us healthy, as well as ensuring the welfare of these animals is kept up to the highest standard.
Yes. So who is this conference for, and what will we be learning, or what will we be exposed to at the conference?
All right, so our One Health Conference, again, is bringing together the multiple disciplines that, that contribute to the health sector. And from our lineup, you'll see multiple disciplines are there. We have, environmental scientists, we have geologists, we have infectious disease specialists, we have mental health, all that kind of thing is all integrated in there, plant health as well. So the audience is broad. Anybody who is interested in the topic can attend. And of course, they're going to be the doctors, the physicians, and the vets, with dentists, public health inspectors, nurses, animal health technicians, environmental persons. So we have a broad spectrum of audience. And I mean, last year's conference in January of last year, we had almost 2,400 registrations.
Oh, wow.
With 1,400 people attending on each day. It was free to attend. The conference is free to attend for anybody. But this year, for the professionals who need continuing medical education credits, it's a small fee, for the whole processing thing of doing the certificates and getting them sent out.
Okay.
Dr. Buckland, I'm going to ask my stupid question of the day. So, So, for instance, my wife and I have the same doctor. We share a doctor, as in, good morning, Dr. Lee Martin.
Oh, he's my friend.
Okay. And our child has a pediatrician. Good morning, Dr. Boyd. And she has her doctor specifically for woman stuff. But who is a family physician? And what makes a family physician a family physician? Because we understand OBGYN and pediatrician, etc. But who is a family physician?
A family physician, a family doctor, is an individual who look after the entire family from when you're born to when you die. If somebody chooses to go to a pediatrician, a specialist for children, or a gynecologist, that's fine. But we are like the referees. We're managing the entire process. We have our eyeballs on the entire family. So we know, once a family is introduced to us, we know what makes that family's heart beat, who is special, who needs support, how we can get the family to support each other. So we just won't just see one person, we kind of encourage the family member to introduce us to other persons. Because what affects one is going to affect the other. So a child may actually have a particular condition which may affect the parent and the other way around, or a pet, maybe in the family. So this is what you call a family doctor. If I may just say something that's linked to this.
Yes.
So after burial, terrible disaster. A patient of mine apparently went to the market and got some guineas, and he didn't wash them, he just started to eat them. His daughter, a young lady, recognized that her daddy wasn't clicking. Something was really wrong. So she took him immediately to a certain hospital, and they did a dengue test. It came out positive. Wow. And quick time, he was referred to KPH. If she hadn't acted quickly, he would have become septic, because the man is diabetic. So it's important to recognize sepsis, and sepsis is one of the things here, climate change and sepsis, because in climate change we have storms, and people can be doing things and forgetting to wash their hands. Prevention is better than cure. Guys, ladies, wash your hands. Remember that what we learned in COVID, keep those safety precautions, prevention measures going all the time, because that little thing is going to save lives. If she hadn't done that, she would have buried her daddy.
Alice, I think the disease we're talking about was leptospirosis.
Leptospirosis. When I said dengue?
Yeah, you said dengue.
It could have been dengue, but it was leptospirosis.
The guineas were probably contaminated with rat urine. So again, the One Health connection. Animals transmitted to humans through plants.
Yeah, but even COVID itself, Doc, they said the origin was from a wet market and all of that stuff.
COVID had an animal origin, but guess what? COVID became a human disease, but then humans started to transmit it back to animals. We were transmitting COVID to our pets. We were transmitting it to wildlife, so dogs, cats,
we're all interconnected.
The big cats were getting COVID from us. That's what's called anthroponotic transmission.
Anthroponotic?
Anthroponotic. Anthroponosis. Anthro, of course, anthropo meaning human, right?
Yes.
So the opposite now, the animals transmitting to us is zoonosis or zoonotic.
All right, so talk to me, Doc, because we need to learn these terminologies. I always love to learn. When and where will this conference be held? What time will you start? And who needs to come?
Okay, it's this Saturday and Sunday. In the afternoons. On Saturday afternoon, it starts at 4 p.m., runs till about 8 p.m. That day covers most of the environmental issues, so we'll have the climate change issues, we'll have the plant health, we'll have the earthquake talk. Then the next day, Sunday, we start at 3, that's Sunday the 19th. It runs until about 7, and this is where we have infectious diseases. We have 2 high-powered international speakers, Professor Latifa Hassan, she is a co-chair of the Prevent Pandemics at the Source organization, global organization. So she'll be talking to us about building the One Health workforce in pandemic prevention. We have Dr. Raymond Hamunga out of Zambia, who is a One Health specialist with the Africa CDC, who has vast experience with, Africa has had to deal with a lot of disease problems, that are cross-cutting. And so he'll be coming to share with us, because we are just beginning. I mean,
And
the,
where will it be held?
Ministry of Health
Zoom?
is... Yeah, it's on Zoom. It's online.
Okay.
So if you go to the JVMA's website, jvma.org, there is, right on the homepage, there'll be the information where you can click
the link.
and register. Of course, that's free. If you're a professional and you need CE credits, then you can you have the link to pay the fee.
Awesome.
Right?
Thank you very
Thank
much.
you
But
so
everybody
much,
is
Doc.
welcome.
Beautiful.
Appreciate it.
Thank you.
Everybody is welcome.
Everybody's welcome. One Health, one CVM, one Sunrise, one Health Conference. Sign up today, this Saturday and Sunday. Our guests have been Dr. Aldith Buckland, co-chair of the CCFP-JA, and Dr. Paul Cadogan, co-chair of the JVMA. Coming up next, UTech student excelling at World University's debating championship. Dennis World, that's it up. And my world too. Yeah. Let's go and for the break. And when we come back, more Sunrise right after this.